Hi, I'm Noel, I'm a psychotherapist. Welcome to my YouTube blog. I'm here at the Canton Treatment Centre in Malibu in California. I'm flying home today. I'm looking forward to that, but I've had a great weekend here with folks, part of the Foundations Recovery Network. I've got the clinical director, Ian. Don't be put off by the title, he's a really nice guy. And he's here, he's sort of responsible for making sure people get what they need at this place. And he holds the team together. And it's an extraordinary place. I mean, I came here sort of just thinking, you hear all these really complex medical type words, and actually you don't get that. What you get are a bunch of people who are really highly qualified, and so highly qualified they're not worried about it, right? And they're here to be people and create a holding environment should you need it. I'm going to shut up now. I'm just going to ask you, Ian, just tell me what it is that you do here and why you do it, really, I guess.
Sure. So the Canyon at Peace Park is a 16-bed residential treatment center. And what's really unique about our environment here is really the physical surroundings in one regard, and then the depth and quality of the program that we run. And oftentimes people's first experience coming on the grounds here is just being sort of breathtaken by the beauty of the surroundings.
Yeah, I get that, yeah.
And that's, in many regards, is sort of the window dressing of the program and really what defines us, I believe. And I'm a bit biased with it, but is the strength of our clinical team, the multidisciplinary nature of treatment here, and really.
And what does that mean for people who don't know that word? What does multidisciplinary
Sure.
mean?
So we have what we try to provide is comprehensive, integrated treatment for
Right.
people with co-occurring disorders, and so we have a number of different types of treatment professionals on our team. We have 4 licensed psychotherapists, either doctoral level or marriage and family therapists. And then 2 medical internists and 2 psychiatrists, and then a number of support staff that are master's level and varying degrees of certifications. And so we have people from a number of different disciplines and backgrounds that we bring together to inform our treatment.
And that's interesting. That sort of what's that like? Does that create a lot of conflict, or do you actually get on well? I mean,
No, I think that's the beauty of it. I think our team here is really collaborative. We sort of get the ego out of the way and make sure that what we're doing is really strongly individualizing the care that we provide for our patients.
And it's interesting because I'd have thought that could really disintegrate, but you use this word integrated model, and I'm just interested in what that means from your perspective.
Sure, yeah, that's a good question. So a really great example of it is what happens in our clinical team meetings every Wednesday. We all get together and sit in the round, discuss each case for as long really as we need to, sometimes taking up to 4 hours to discuss as few as 12 patients sometimes. And the idea is to bring as many different perspectives on the case from everybody's different background into the room to structure treatment, to identify where we need to intervene, and essentially how we can help people across the full spectrum.
That's really important, because when people come to see me, quite often they come with a number of different diagnoses and labels, and it's almost like there's bits of them falling off all over the place. I really get the sense that you pick up all those bits.
Yes.
And you hold them in together, and you give people a place in which to really discover who they are.
Yes, exactly. In essence, what we try to do is assess people across all the different domains in their lives and provide a treatment plan that's comprehensive in that way.
And you know what I got most from coming here is your warmth and compassion as a person. I don't mean to embarrass you, but you're just such a nice bloke.
I appreciate that. Thank you.
Do you know what I mean? And it's like everybody I meet here is really kind and caring. And I was actually really surprised by that. Where do you get that from? I mean, is it from personal experience or other people? What happens? How do you find that?
I think what we try to do here is build a team of truly passionate people, compassion, a lot of empathy for the severity of issues that people are bringing into treatment with them, and just creating a really safe, warm environment for people to sort of take a step back from what's going on in their life outside of here, cross the threshold into treatment, and really it's beautiful surroundings in the sense that people descend down into our property and leave life out there and gain really deep perspective on what's going on. And so to have really safe, warm space for them to do that with a lot of intelligence and knowledge behind that is.
Well, I'm just going to underscore and probably come to an end with the video now, but just want to underscore that safe, warm space, because that's the defining feature for me, is the safety and warmth of this place. You know, that descending into the canyon was amazing. Then yesterday I climbed that 250-foot high platform, and I was trusting enough to let people hold me on a rope and let me fall backwards.
Fall off
I mean,
the
seriously.
tower, harness.
And I'm not stupid. I only do that because I genuinely trusted people to do that with, you know.
Yeah.
And you created that for me in an hour or so. I mean, I can't imagine how amazing it must be here for, I mean, somebody would be here 90 days, right?
Yep.
And just to have that every day,
Yeah.
I mean, that's going to heal you, right?
Yes, I believe so, and that occurs across the whole span of our team here. So.
Fantastic. It's really amazing to see you. Thanks for
Yeah,
giving me your time
wonderful
this morning.
to speak with you. Thank
All
you.
right, take care, mate.